12 birth control methods. Selection of birth control depends upon the time period for which you do not wish to conceive. This time period may be short-term, long-term, or never. Choosing a safe and effective birth control method is a difficult task. It is best to discuss with your doctor before going for any particular birth control method. Some methods are prescription-based while some are non-prescription based. Things to consider while choosing a birth control method: your existing health issues, if any, how useful it is, the ease to use it, how sexually active you are, the time period you don't want a pregnancy, if it protects you from sexually transmitted diseases or STDs, its side effects, if any, and above all, how comfortable you feel in using a particular method. It is best to discuss all these things with your doctor before going for any particular birth control method. The available birth control methods are male and female condoms, regular birth control contraceptive pills, emergency contraceptive pills, vaginal ring. It is also known as NUVA ring, made of soft plastic, small in size, flexible, which is inserted in the vagina for a particular time period to prevent pregnancy. The ring releases the hormone which inhibits ovulation and works as contraception. Skin patch. Women need to wear this patch on their skin once a week for 3 weeks continuously. After 21 days or in the 4th week, you are not required to use this patch and you will be having your menstrual periods. This method works as a contraceptive method to prevent pregnancy. DEPO PROVERA injections. These are contraceptive injections, also called birth control shots, given to a woman to prevent pregnancy for 12 weeks. You have to get it every 12 weeks till the time you don't wish to conceive. Copper IUD. This is the most effective, safest, and long-term method of contraception and used worldwide for decades. This is a T-shaped small device placed in the uterus to prevent pregnancy. This can prevent pregnancy from 3 to 10 years. Contraceptive implant. This is the small matchstick size rod made of plastic and is flexible, implanted into the skin of upper arm area to prevent pregnancy. This device releases the hormone which blocks the ovaries from releasing the eggs. This lasts in your arm for 3 years and provides protection till 3 years only. You need to get it changed every 3 years. If you wish to conceive, you may take it off even before 3 years. Spermicides. Spermicides are the substance inserted into the vagina before intercourse to kill the sperms or before entering into the uterus. Spermicides are available over the counter in the form of gels, tablets, lubes, or cream. This method is to be used correctly and spermicides need to be inserted deeply into the uterus every time before intercourse. Sponge. These are soft disposable sponges made of soft plastic foam filled with spermicides inserted into the woman's vagina before intercourse. Sponge blocks the sperms from entering into the uterus and spermicides kills the sperm cells. Diaphragms. These are flexible cervical caps, silicone cups made of soft rubber that is filled with spermicides and inserted into the woman's vagina before intercourse. Diaphragms blocks the sperms from entering into the uterus and spermicides kill the sperm cells. The diaphragms or cervical cap should be left in place for at least 6 to 8 hours but not more than 24 hours after sex. Withdrawal. In this method, male pulls his organ out of the vagina when he is about to ejaculate and ejaculates outside the woman's sex organs. But this method is not 100% safe. Female sterilization or tubal ligation. This is the surgical procedure to control birth for women to permanently prevent pregnancy. During the female sterilization process, Fallopian tubes of women are cut and tied to permanently prevent the pregnancy. Female sterilization blocks the eggs and sperms to travel through the fallopian tubes. This is the permanent method and cannot be reversed easily. To reverse this, it needs a major surgery which may not always be effective. Male sterilization or vasectomy. This is the surgical procedure of permanent birth control for males. In this method, tubes of the male which carry sperms are cut and tied to prevent the sperm from entering into the uterus. Male still has the semen, but that doesn't contain sperms. This is permanent method and cannot be reversed. Fertility awareness. It is the method for females to learn about their most fertile days. Check your basal body temperature to know when you are ovulating and not to have intercourse on those days or use condoms. Which method is best? Every birth control method has its own pros and cons, so it is strongly recommended to discuss all these methods with your doctor before going for any particular birth control method. Some useful tips. Ask your doctor about how to use the diaphragms and sponge methods correctly to prevent pregnancy. Male and female condoms are the only methods to provide protection against sexually transmitted diseases. Selection of birth control options depends upon the term, cost, effectiveness, and acceptability of your partner. Bleeding, abdominal pain, spotting between periods, nausea, headache are common in some birth control methods. It is recommended to consult your doctor if you feel any of these symptoms for a longer time than usual. Breastfeeding also works as natural contraception but may not be 100% effective. Ask your doctor about safe contraception methods during the lactation period. Female and male sterilization methods are chosen only when you do not want to have more babies. Take time, discuss with your partner, and consult with your doctor about the safe contraception methods according to your health conditions. Happy health, good luck.